Chapter 6, Blood Collection Equipment. By the end of Chapter 6, you should be able to describe the latest phlebotomy safety supplies and equipment, identify the various supplies that should be carried on a specimen collection tray when a skin puncture specimen must be collected, list the various types of anticoagulants and additives used in blood collection, examples of tests performed on the specimens collected in the tubes containing them, and the color codes for these anticoagulants and additives. Identify how anticoagulants may interfere with certain blood analytes. Describe the differences between the venipuncture and skin puncture equipment and supplies. Identify the types of safety equipment needed to collect blood by venipuncture and skin puncture. Introduction to blood collection equipment. Safety features decrease needle stick injuries. Collection equipment is used for venipuncture, skin puncture, and arterial puncture. Venipuncture equipment includes vacuum tubes and safety needle collection devices, tourniquet, supplies to cleanse the puncture site, labeling supplies, gloves, special trays to transport blood specimens. See Box 6-1, Equipment for Routine Venipuncture in your book. Venipuncture equipment. The vacuum evacuated tube system requires an evacuated tube, a special needle, and a special safety plastic holder adapter that covers the needle after blood collection. One end of the double-pointed needle enters the vein, the other end pierces the top of the tube, and the vacuum aspirates the blood. Here's an example of a vacuum tube, and here's an example of the vacuum evacuated tube holder system. Blood collection tubes and additives. Two criteria are used to describe the vacuum tube size: external tube diameter and length, and maximum amount of specimen to be collected into the vacuum tube. Please see Table 6-1 in the textbook. Blood collection tubes and additives. Tube tops are color-coded according to the additive: serum, plasma, or whole blood for various assays. Many coagulation factors are involved in blood clotting, and coagulation can be prevented by the addition of different types of anticoagulants. These anticoagulants often contain preservatives that can extend the metabolism and lifespan of the red blood cells, RBCs, after blood collection. Yellow-topped tubes, vacuum culture vials, and ACD tubes. They are sterile tubes that contain sodium polyanethyl sulfonate, SPS, used for blood culture specimen in collections in microbiology. Blood can be collected directly into vacuum vials containing culture media. Tubes containing acid citrate dextrose, ACD, additive is used for specialty blood banking. This is an example of collecting blood for culture using the BD Bactic. Light blue top tubes contain sodium citrate. Many coagulation procedures such as PT and APTT are done on blood collection in light blue topped vacuum tubes. If light blue top tube underfilled or overfilled, coagulation results will be inaccurate. Serum separation tubes, mottled topped, speckled topped, and gold topped tubes. These tubes must be gently inverted with the blood to ensure mixing with the clot activator. These tubes contain a polymer barrier in the bottom of the tube. During centrifugation, the polymer barrier forms a barrier between the serum and the blood cells. This is a vacuette serum tube. The rapid serum tubes, RST. Orange and gray, or yellow, vacuum top tubes have additive thrombin, which completes clotting of the blood in less than 5 minutes. These are used for stat emergency laboratory procedures requiring serum specimens. Red top serum tubes. Red top tubes are tubes without anticoagulant or polymer gel barrier for the collection of serum. Collected blood will clot in the tube. After blood is collected in the tube, the clotting process begins and takes at least 30 minutes for a fibrin clot to form. Orange top tubes. Tubes with orange tops have a thrombin-based clot activator with gel for serum separation. This tube is for stat serum determinations in chemistry. Blood clotting time is only 5 minutes. Green top tubes contain the anticoagulant sodium heparin and lithium heparin. These tubes are used in various laboratory assays requiring plasma or whole blood. They should not be used for collections for blood smears. BD Vacutainer Barricor tubes uses mechanical separator technology that reduces centrifugation time from 10 minutes to 3 minutes, reduces cellular contamination by 50 to 65% compared to other current plasma gel tubes. Purple lavender top tubes contain EDTA, are for hematological procedures and molecular diagnostic testing. Pink top tubes contain EDTA and are used for blood bank collections. Gray top tubes usually contain 1 potassium oxalate and sodium fluoride, 2 sodium fluoride and EDTA, or 3 only sodium fluoride. They are primarily used for glucose sugar test. The anti-glycolytic agent and the glycolytic inhibitor are the terms for this tube's additive because it slows the chemical process of glucose breakdown. Royal blue top tubes and tan top tubes, used to collect samples for nutritional studies, therapeutic drug monitoring, and toxicology. The royal blue top tube is the trace element tube, and the tan top tube is used for lead testing and contains EDTA. Black top tubes. A black top tube with sodium citrate for blood collections is used to determine the erythrocyte sedimentation rate, ESR, is available from certain manufacturers. Molecular diagnostic tubes. Special sterile vacuum tubes for molecular diagnostic studies, available containing different additives, for example, sodium citrate, sodium heparin, as required for the different testing procedures. Manufacturers have different colored tops. Tube organizer. TIMO, Tube Management Organizer, is an innovative test tube holder that assists with managing the test tubes during the blood collection process. Here's an example. Safety syringes. They are used for patients whose veins are too fragile for blood collection with vacuum tubes. They are hazardous and pose an increased risk of accidental needle sticks. Sometimes they are used for collecting blood from central venous catheters, CVC lines, and they consist of a needle, safety cover, hub, barrel, and plunger. Here's an example. The syringe needles should be shielded after blood collection, removed, and discarded in a Sharps disposal container. BD blood transfer device is attached to the syringe and a vacuum tube is inserted into the transfer device. The blood is transferred from the syringe to the blue tube using the tube's vacuum. Here is an example of a BD safety glide. Safety needles and holders. Gauge and length of a needle. Gauge number indicates diameter of the needle. The smaller the gauge number, the larger the needle diameter and the higher the flow rate. Larger 16 to 18 gauge needles are used for collecting donor units of blood, 450 milliliters or less. Smaller 21 and 22 gauge needles are used for collecting specimens for laboratory assays. The BD Vacutainer Eclipse safety shielding blood needle is attached to a holder. Gelco Venipuncture Needle Pro has a protective holder and provides a single-handed technique. The retractable technology's Vanish Point blood collection tube holder automatically retracts the needle directly from the patient when end cap is closed after the last tube has been removed. The Evacuate Quick Shield safety tube holder device is used to prevent accidental needle stick injuries during venous blood collection. Here are some examples. S-Monovet blood collection system. Enclosed multiple sampling blood collection system. Collects blood using either an aspiration or vacuum principle of collection. Each needle has an integral holder that does not require assembly before use and cannot be disassembled. Here's an example. Needles. Check the tip of each needle for damage. It is important to use needles with holders or syringes that are compatible with the needle to avoid possibility of leaking blood and blood exposure. The butterfly needle blood collection set. It is also called a blood collection set or winged infusion set. It is the most commonly used intravenous device. Most common butterfly needle sizes are 21 and 23 gauge, and length of these needles can range from 1/2 to 3/4 inches long. These safety needles each have a shield that automatically covers the contaminated needle point upon withdrawal from the patient's vein. Here are some examples. This is the Vacuette safety blood collection set. The needle and other sharps disposal. They must be discarded in rigid, leak-proof plastic containers. Each unit is usually orange or red. Disposable as biohazard waste. Here's an example. Tourniquets. The tourniquet is key to a successful venipuncture. It provides a barrier to slow down venous flow. It is used in specimen collection to apply enough pressure to the arm to slow the return of venous blood to the heart. Types: pliable strap, Velcro type, blood pressure cuff, Sarah-kit with a seatbelt design. Non-latex disposable tourniquets are available. Many facilities use a disposable natural latex tourniquet strap to help prevent cross-contamination. Here is an example. Gloves for blood collection. Use non-latex gloves. Do not use gloves with powder. Here's an example. Antiseptics, sterile gauze pads, and bandages. These items are needed for blood collection by either venipuncture or microcollection. 70% isopropyl alcohol preparation and chlorhexidine swab sticks or pads for blood cultures are essential for blood collection. In home healthcare and other ambulatory healthcare environments where soap and water may not be available, a waterless antiseptic agent should be carried with other blood collection items and used before and after blood collection. Microcollection equipment. Usually, skin puncture blood collecting techniques are used on adults and infants when small amounts of blood can be used for diagnostic lab tests, and also if the venipuncture is excessively hazardous for a patient. Lancets and tubes. Clinical Laboratory Standards Institute recommends a penetration depth of less than 2.0 millimeters on heel sticks to avoid penetrating bone. Lancets and tubes. BD Quick Heal Infant Lancet and the BD Quick Heal Preemie Lancet. That's the Quick Heal. This is a BD Microtainer Contact Activated Lancet. Terumo Capiject Safety Lancet. Grainer Bio 1 Mini Collect Lancelino Safety Lancets for micro collection. Neat Nick Preemie Lancet. Microcontainers. Plastic microhematocrit capillary tubes. Disposable narrow bone pipettes used for packed red cell volume hematocrit in microcentrifugation. They have colored bands. A red band indicates a heparin-coated tube, and a blue band indicates no anticoagulant. Plastic microcollection containers for general laboratory collections, usually color-coded according to the established protocol for blood collection vacuum tube tops. Here are some examples. Safety fill, capillary blood collection tubes. BMP Leukocheck Microdilution System, collection and dilution unit for blood samples. Disposable self-filling diluting pipette. Consists of straight, thin-walled, uniform-bore plastic capillary tube fitted into a plastic holder. Includes a plastic reservoir containing a pre-measured volume of buffered ammonium oxalate solution. Specimen collection trays, taken on blood collecting rounds, made of plastic, preferably latex-free that can be sterilized, includes all necessary collection equipment. For home healthcare providers, carry an enclosed container with the biohazard symbol visible on the outside, lockable to protect the contents from tampering or accidental contamination, with a tight seal to reduce the risk of infection from bloodborne pathogens due to spills or accidents. This is an example of a specimen collection tray. We have reached the end of Chapter 6. Thank you for watching.